What's one misconception people have about racial equity work in public health departments?
That it's an additional step in the process. I think some people think of racial equity as an add-on, as something, this is something now that I also have to do in addition to my role, when it really should be viewed as the foundation of the work that you're doing. It should be embedded in the work that you're doing. So I think a misconception, that's one of like the main misconceptions that I see. And because of that, I think it leads into another misconception that people, especially people who maybe aren't in community engaging roles or have that face time with other folks, they might think that their role has nothing to do with racial equity. So I'm also thinking, not to call them out, but a lot of admin and finance folks think, well, like, I have nothing to do with racial equity. I don't support racial equity work. But it's like, yeah, you do. Like, you're actually the gatekeepers of a lot of like the finances, a lot of the systems that allow folks to do their jobs, that allow folks to go into the community. So you're directly supporting racial equity work.
Hey friends, welcome to Public Health Careers. I'm Omari, Richins, founder of the Public Health Millennial. Every other week, I interview leaders and practitioners across public health, sharing their expertise, lived experiences, and the strategies that can move you and your career forward. Today's guest is Alexander Bonano. Alex is Health Equity and All Policies Project Manager at Boston Public Health Commission. His work centers racial equity, community engagement, and systems change, not just in theory, but in practice. He works at the intersection of policy, community voice, and government systems. His path into public health weaves through education, youth development, global health experiences, and deep community based work. They earned their Bachelor's of Arts in Latin American and Latinx Studies at College of the Holy Cross, followed by a Master of Public Health in Health Services Management and Policy at Tufts University School of Medicine. In today's episode, you'll hear and learn more about how his global health, education, and public health experiences shaped his local public health focus, what are some of the misconceptions about racial equity and how they hinder progress in public health, why mentorship helps humanize students and reduce racial biases, how money can be a form of harm reduction, the importance of authentic and people-centered community engagement in public health initiatives, and much, much more. Be sure to hit that like button, hit that subscribe button, and enjoy today's episode.
Hello, everyone. My name is Alex Bonano. I'm a brother in public health, and you are listening to Public Health Careers.
Alex, it is so good to cross paths in this way and to have you on the show. I know we've been connected in a meaningful way for the last, I don't know, year plus or so,
Yep.
doing some work in Brothers in Public Health, but looking forward to hearing more about your career journey. So welcome to the show.
Awesome. Thank you for having me.
Truly, truly is my pleasure. So to jump into things, tell us, how do you identify and tell us a little about your personal background?
Awesome. I identify as a black man, Bostonian, born and raised, Caribbean. So on my mom's side, she's African American, but on my dad's side, I'm Puerto Rican and Honduran. So I have those he- different heritages that I feel like I carry with me and show up with. I'm from Boston, like I mentioned, born and raised from Roxbury. So for those who aren't familiar with Boston, I like to call it I like to call Roxbury like Boston's Harlem. So it's like Boston's predominantly black neighborhood, historical black neighborhood as well. So um, grew up here. Now I work for the city of Boston, which is also located, or at least the Boston Public Health Commission is located in Roxbury. So being able to just be here and give back to my community in that way has been great for me. But yeah, I would say definitely identify as black man, black Caribbean man, Latino as well, and grew up, just being blessed with community, being blessed with family, being blessed with, grandparents that really took a huge role into my education and making sure that they, wanted to see the best out of, my siblings and I. So they just growing up with that love as well, that familiar love, that close, tight knit family, I feel like is has been helpful and just like grounding me as a person. So I would say that that's a little bit of my personal background outside of like education and career stuff.
Yeah, I appreciate that. Shout out to the fam.
Yeah.
Okay, so you currently work as a health equity and all policies project manager at the Boston Public Health Commission in the Office of Racial Equity and Community Engagement. What inspired you to focus your career on racial equity and community engagement, or how did that kind of come up?
Awesome. That's a great question. I think it also ties into why I even got into or how I got into public health. So it might be a long-winded way, but bear with me. So, what inspired me? So, as I mentioned, growing up, I grew up in a Caribbean household, an African American household, and I'm also an identical twin. So that's like a fun fact that most folks don't
I
know.
I didn't know that.
Um,
I don't think I
yeah.
realized that. Okay.
Yeah, so I have an identical twin. And growing up, it was always I'm gonna be the doctor and he's gonna be the lawyer.
Mm.
So that I feel like shaped that expectation. I feel like shaped my career trajectory or my perception of what my career trajectory was going to be. So for the longest time, I've always like excelled in sciences, and so when I went to undergrad, I started undergrad as a chemistry major pre-med, thinking that I was going to be the doctor that I've always been told that I was going to be. Um, and then it wasn't quite going the way that I wanted it to. It was a little bit of a struggle for me. College was difficult. My twin brother and I, we ended up going to separate schools. So I felt like there was a lot of just transitionings happening all at once. But I stuck through with the chemistry major up until junior year of my sophomore year, fall semester of my junior year, excuse me. And so I did a medical internship in India where I was shadowing a emergency physician, and all of his patients were accidental poison victims. They were inhaling and ingesting the organophosphates that are found in it's a chemical that's found in pesticides. So we were at a hospital like in the countryside, and so a lot of the patients there like they didn't know that they needed PPE
Mhm.
to while they were using the pesticides to grow their crops, or they didn't have the money to afford it. So I remember being so upset about that experience and like, seeing all of them there that is completely avoidable. And so I went back to school to my chemistry advisor. He was asking me about my experience, and I was telling him, I was like, this is infuriating. These are people whose lives are at risk. They could have potentially lost their lives. Um, and there was, for something that's avoidable. So he told me at the time, shout out to Professor Mills. He was like, that's not medicine, that's public health. Like it sounds like you're more concerned around like the systems and equity, et cetera, like not necessarily the treatment. Of course the treatment matters because you don't want them to die, but your passion from you sharing your experience sounds like you're more concerned with that, and that's not medicine, that's public health. And so that switched everything for me. But particularly back to your question around like racial equity, my first ever experience dealing with like racial bias, especially as it pertains to healthcare, was with my mom. Racism, not even racial bias and racism, was with my mom. So I have a twin brother, but I also have a younger brother who's 8 years younger than me. And so when after my mother gave birth, she ended up getting a tubal ligation. She got her tube side. She said, "No more kids. This is too much." Um, and she had a visiting nurse that would come to just check on the wound to make sure that it was healing correctly, and ended up getting infected. And one day, the second visit that the visiting nurse actually came to check in and make sure that it was clean, she called me into the room and said, "Hey," like she called the both of us. She's like, "One of you all need to come here and like watch me take care of your mom's wound." So like cleaning the outside of the wound and then packing it with gauze so that it closes and heals correctly. Um, and so I remember like thinking like, oh, like I'm gonna be the doctor, like as I've always been told. So I'm gonna do it. I'm gonna be the one to learn. And she never came back. She told my mom that Roxbury was, too ghetto for her, too unsafe for her. And this is a visiting nurse, someone who's been charged with taking care of my mom. And she told my mother she's not coming back, and she taught me how to do it. And I literally was the one who nursed my mother back to health to make sure that her wound didn't stay infected. So I think I think back to that time. So I think about both of those different instances in different parts of my life. I feel like both combined to inform why I do the work that I do, why I'm interested in the work that I'm interested in, why I really want to focus on racial equity and community engagement, especially within public health, because it is deeply personal, for me and my story.
Yeah, I appreciate that, and I know we'll dive more into your undergrad journey and that shift. But that's also very enlightening, very sad that you had to
Yeah.
go through that, and I'd imagine that that is still the case for many people out there. And it just begs the question of like, you say you want to give people access, but like what does that access really mean, and how do you create systems in which all people are given the type of access that they need? And um
Mm,
yeah, I feel like there's a huge case to be said around dealing with implicit bias and racism in medicine and in healthcare, and that could be a whole other conversation.
Yeah, absolutely. It could be a whole seminar, more than a seminar.
Right, right. People probably get their dissertations on that.
Exactly.
Right. So taking you back to like your role, first maybe describe what Boston Public Health Commission is, and then what do you do as a health equity and all policies project manager?
Awesome. So for those who don't know, Boston Public Health Commission is the nation's first ever um, public health department. It's the oldest health department in the United States. And what do I currently do as a health equity and policies manager? That is a great question. I feel like it's a little bit of so many different things. So I'll zoom back a little bit before I answer that and just share a little bit more about like my office. So as Omari mentioned in the beginning, my team is the Office of Racial Equity and Community Engagement. So we are a part of the executive office. And so we really seek to establish racial justice, health equity work in all of the commission's doings and decision making. So in policy decisions and community engagement initiatives, etc. We are a mighty team of four, but we support almost 1,400 employees into making sure that we're embedding that work, that racial justice, health equity work into everything that we do, regardless of department, bureau, or division. So what that lends itself to for me, my everyday role is to be providing a lot of technical assistance to folks, both internally and externally. So also thinking about our other brother and sister city departments, um, like how are they doing this work? How are they thinking about health? So health equity in our policies really thinks about, as a concept, really thinks about like cross-sectoral collaboration, bringing non-traditional health partners to the table to really get them to understand what their role is and how they contribute to the health of the populations and the constituents that we serve. So it's a lot of technical assistance, both internally and externally, a lot of facilitations and trainings. But then also, for my particular role, I was able to take our funding. So we have back in 2020, the city of Boston declared racism a public health crisis and gave different city departments funding. So the Boston Public Health Commission received some of that funding, which I oversee and have used to create our Generational Health Scholarship Program, which seeks to provide monetary support for BIPOC Bostonians that are studying for a bachelor's degree in STEM, behavioral health, public health, and the health sciences. And so that's another major part. So I manage three strategic partnerships for that initiative, with each of those partnerships supporting a cohort of around 30 students each. So, and tracking those students from, the goal is to track those students from their first year all the way through their senior year. So the complete collegiate career, they're getting that financial assistance and also wraparound supports. So tutoring, mentoring, any social behavioral supports that they might need as well, um, is one of the things. So if I'm not in the office or out providing technical assistance, I'm usually running around doing something for the scholarship program, putting together cohort events for that, managing those strategic partnerships as well. Um, and then in addition to TA, I would say internally, just also thinking about other strategic initiatives. So as I mentioned, like policy. So I supported our first ever policy agenda, which was just, a great experience to really put together all of the different legislative priorities that we want to be supporting as an organization. And then also just thinking about different internal policies as well. So I supported the creation of our first ever equitable community compensation policy, which is hopefully going to be released soon internally, and then also updating and supporting our equitable, or now transformational community engagement policy and plan. So a lot of policy work as well. So technical assistance, policy work, and then the generational scholarship program are, I would say, like my top three bucket areas at the moment.
Thank you for giving us an overview of that. And in your role, you're doing a lot of work that's working to move like equity forward. And oftentimes it might be in spaces where people, or well, more likely organizations, have competing priorities and different levels of buy-in. What does it take to continue to move the work forward?
And one of the trainings that I give, like we really speak to breaking down silos. But before you even get into that, also just acknowledging the competing priorities. I think local government in and of itself is set up in a way in which you do compete. And so trying to not address the elephant in the room, I feel like isn't conducive to actually getting the work done. So I think that that's one of the things that we lead with is like, okay, like we know that your team might be doing X, Y, and Z, or you might have this competing priority. But how are we thinking about moving forward in regards to a collaborative approach? Like, what does collaboration look like? Could we have collaborated on this initiative with this grant? Because that's another thing. Like, funding is always like a competing issue as well. Like, there's enough funding to go around, but then sometimes there's really not. Like, we really need to be thinking about that. And so thinking and allowing folks to think about how they can be a little bit more strategic and collaborative in a forward thinking way, like not being in a proactive way, not being reactive and like, oh well this already happened and I applied for it, so haha, but like more of like, hey, this actually sounds like a great thing that we could potentially collaborate and partner with. So let's actually come to the table and figure out how to do that. I also think too another thing in regards to moving equity work forward is also just reminding folks of the larger picture. I sometimes think that, as I mentioned, even for myself, like the work can be personal, and I think one of the unique aspects of the Boston Public Health Commission, at least, is that we are also residents. So there is that tie. Like we are mandated to be residents of the city in order to work here. So sometimes we show up with both of those identities, and it's kind of hard to delineate the two.
Mhm.
Um, but because it is so personal, when things don't happen a certain way for folks, it can, stir up some emotions. But I think reminding folks of like, okay, these are the constituents that we serve. These are the health issues that we need to be addressing because these are the health outcomes that we currently see, and these are the trends that we're seeing. Like that's the bigger picture that we need to be focusing on. And I think reminding folks of that has also been, at least for me, really helpful in moving that work forward. And then I would be remiss if I didn't mention like there's just so much like local bureaucracy that also happens. Is like you have to think about those things when you're trying to like move initiatives forward. And so big wheels definitely can turn slowly when it comes to local government and doing the work. But I think it takes a lot of tenacity. It takes a lot of what I call being pleasantly persistent. Of reminding folks like, hey, we have real work to do because the health outcomes that we're seeing have real implications. And there'll be even more disastrous implications if we don't do the work that we need to be doing. So I think level setting and reminding folks of our mission and our vision and what we're trying to do, in addition to acknowledging all of the different parameters that may be pain points for folks or maybe contributing to the silos that we're trying to break down, I think has been helpful.
And you spoke to developing policy, particularly an equitable community policy. What does that work look like? I feel like a lot of times we hear policy work and it can mean different things in different contexts. So maybe for like a student or someone that's early on, like maybe help us understand like what is it exactly that you're doing?
Got it. So I think in the literal sense of actually like developing a policy, so developing the guidelines of like what and how we are institutionalizing like action steps in order to say like, hey, this is the work that we need to be doing and we're not currently doing it, but we are now going to be mandated to do it as an organization, not just individuals or individual teams doing it and then other folks aren't. So I think that that has been something that's been new, because I think to your point too, I'm like, oh, like policy, like oftentimes I just jump to like legislative work and not necessarily like that institutional piece of like, hey, like we need to be thinking about how are we actually doing the work that we need to do in order to see the results that we need to see as it pertains to bettering the health outcomes of our constituents. So when I say policy, I'm thinking about that. Like, how are we actually defining the action steps for folks to follow, and institutionalizing that and standardizing it so that everyone is held responsible to do it, so that we don't see that, that diversity tax or that inequitable distribution of responsibility. Like, everyone's responsible. So it takes a lot of coordination. So, like, for my office, and then like general counsel, of course, our Office of Intergovernmental Relations, our Director of Policy, like we all have to come to the table to make sure that everything's aligned. And of course, like, the commissioner has to approve of that, but it takes a lot of like internal coordination, and then a lot of thought partnership for sure to just, what are we actually writing? Does it make sense to folks? Workshopping that, anything that needs to be changed. And then the implementation piece, which I feel like is always the hardest part, like holding folks accountable. What does an accountability measure actually look like to make sure that people are doing what they're supposed to?
Yeah. And in your role, what are some of the things that you like the most and some of the things that are most challenging?
Mm.
I think one of the things that I like the most is that no one's had this role before. I'm the first ever person to actually be in it, which can also be a little bit of a challenge because I don't really have um, like a North Star to follow or any notes to follow or to pick up from. But I also feel that it's been extremely exciting because I'm now laying that groundwork for whoever is to come after me. But also, I would say one of my favorite parts that I also like about it is being able to see through like the facilitations and the trainings in particular, like see the wheels turn for folks. So one of the main facilitations that I participate in, the City of Boston's Equity and Inclusion Cabinet, we have what we call our Equity and Inclusion Academy. And so that brings different city employees from different departments together in order to really just train them and teach them about different equity and inclusion concepts. So my office is a facilitator for that training. So we teach a training on the social determinants of health and how to implement how to address the social determinants of health with an equity lens. So what does it actually look like? Um, to consider the different determinants of health that each different person's department addresses. So, for example, like we have like Department of Transportation is there, our Water and Sewer Commission staff might send someone, etc. So you'll have like a myriad of staff from all different departments, and it's really cool to see them work through like, oh, like these are the determinants that I work towards in my role. These are the ways in which I'm currently addressing them. These are how I could be addressing them. These are the different questions, equity questions that I don't ask or that I should be asking when I'm trying to do a new initiative. So just really seeing like that wheel turn, because as I mentioned, like especially for health equity and all policies, like as a concept, like it takes a lot of non-traditional partners to be at the table. And so when we do those trainings, it's always just interesting to see like how folks don't think about how their role really influences health or don't think about how their work or their department is actually influencing or informing the health outcomes of our constituents. So to see that in real time click like, oh, I work in the Department of Transportation. Of course that influences health, but I feel like that's been one of the main lessons that I've taken away from doing this work is that what's iterative to me and maybe what's iterative to other public health professionals isn't always iterative to people who don't do this work. But that doesn't mean that their work matters any less. And so helping them to come along on that journey to row in the same direction, use our language or understand our language a little bit more. Because also that's another learning that I've had was sometimes they call it that, or sometimes they don't call it that. They don't use that language, but they're still doing the work. But how do we reframe it so that they can also understand, like, yes, you actually do um, impact the health of Boston residents. And in our mind, again, as public health professionals, it's like silly, like, how don't you see that? But folks really don't see it, and it's our job to really make sure that we teach them that so that they can learn and understand it and think a little bit more critically about how they can be more intentional in their roles now that they do have this foundational knowledge and understanding.
Yeah, that makes a lot of sense. And I think back to like myself, I had none of the right words for public health before like looking into massive public health programs.
It's so amorphous. That's what I always tell people. Like, public health can feel amorphous because it encompasses everything.
Right.
Like there's nothing that health doesn't touch.
Right. And it's challenging, I think, when people don't have that lens to see that they are a part of that system. But I think it is part of the work to communicate that with them, to let them know that they are part of that.
Yeah.
So you also shared that your position was a new position you built into that role. So let's say someone else out there got hired into a new role. Looking back on your experiences, what advice would you give them to be successful in building out like a new role?
Yeah, I would say one of the first things that I feel like was helpful for me was just really understanding what my parameters were. Um, how far can I go? How creative can I be? What are the limitations? So definitely, I think getting a better understanding of that as soon as possible will definitely set them up for success. Um, and yeah, and just would allow them to just get a better understanding of like what can they actually do. instead of having to go through. I mean, there's always going to be growing pains, but I think you can reduce how much pain you actually have to endure while you're growing in your role, if you can just get those things squared away at first. And I think too, like just remaining patient. You're not going to have the answers to everything. Um, and that's just what comes with. I think that just comes with also just working in local government in general. Like it's just not, or working in general, not even just in local government. You're never gonna be 100% in the know of everything. But I also think that that's the beauty of the work is you get to really participate. Excuse me, um in a recursive process. It's not linear. Like you go through, you make edits, you go back. So I think being open-minded to that, being patient, and really just getting an understanding of what your parameters are, I think would be like the first few tips that I would say for someone who's entering a role that hasn't been defined by someone else already being in it before.
What's one misconception people have about racial equity work in public health departments?
That it's an additional step in the process.
Yeah.
I think some people think of racial equity as an add-on, as something, oh, this is something now that I also have to do in addition to my role, when it really should be viewed as the foundation of the work that you're doing. It should be embedded in the work that you're doing. So I think a misconception, that's one of like the main misconceptions that I see. Um, and because of that, I think it leads into another misconception that people, especially people who maybe aren't in community engaging roles or have that face time with other folks, they might think that their role has nothing to do with racial equity. So I'm also thinking, not to call them out, but a lot of admin and finance folks think, oh, like I have nothing to do with racial equity. I don't support racial equity work. But it's like, yeah, you do. Like you're actually the gatekeepers of a lot of like the finances, a lot of the systems that allow folks to do their jobs, that allow folks to go into the community. So you're directly supporting racial equity work. So, um, but I think because they may not see it as foundational, they see it as additional, that leads to those two major misconceptions that I often see in public health work.
Appreciate you raising that up. And in my 9 to 5 role, our finance department, it's just one person, but our finance department worked on understanding our, what do you call them, the people that we work with, and getting like a background of all like the contracts and all the different businesses that we work with. A vendor audit,
The
that's what they
vendor,
call it.
yeah,
It's
vendors,
vendor
yeah.
audit. And like having like a racial equity lens on that to see like how can we be more impactful, and that's one of the things that we have been doing as an
Yep.
organization. But yeah, I think it is
Yeah.
our job as well to help people see that they are also part of the work that is happening.
Absolutely, and thank you for raising that. Because in another day-to-day, is that I actually serve also on our equitable procurement committee. So actually thinking about how are we institutionalizing our equitable procurement policy, um, which to your point, it speaks to, working with certified underrepresented business enterprises is what we call them cubes. So different like minority owned, women owned, LGBTQ owned, veteran owned, disability owned vendors, etc. And really thinking about where our money goes, because when we're thinking about social capital, when we're thinking about employment, those are all determinants of health. So it's like how are we income? So it's like that is a great way to tell folks, and that's usually the one that I point to when I'm doing trainings, for folks in finance. Like, hey, racial equity right here, and you're supporting that. You're allowing that to happen, so that we can actually give back in a meaningful way.
Yeah, absolutely. And as we learn, you've worked across education, youth development, and public health. How do you use those worlds to inform the work that you currently do?
It's a great question. Hmm. I think immediately what comes to mind in thinking of that question is thinking about the trainings that I do, especially working in youth development and education. So I served as a high school teacher in Brooklyn. I taught health for ninth graders in 12th grade. So I actually started that school's health curriculum. Um, they had like some guidelines, but they didn't really have like a full curriculum. So it was a lot of curriculum development that I had to do for that, and also making it culturally relevant to the students. The student body was 100%, 99.9% Black. Um, And so that was one of the things that I wanted to, and Black, and I'm saying that in like in the overall like umbrella term. So there were a lot of Caribbeans, African Americans, and then also like Black identifying Latinos as well at the school. But so thinking about being culturally, responsive, like how am I talking to them about nutrition? Am I just telling them like, oh, you need to look at the my chart, um, and do that, or am I teaching them like, oh, like you eat, you say you're from Trinidad, so like you had doubles today, like what does that look like? You had palau today, like what are some of the ingredients that goes into those dishes, and like how could you swap some of those things out to make it a little bit healthier? Speaking to them, I think another thing that was helpful and in my understanding is that, especially when it comes to like education and youth development and even in public health work and the trainings and facilitations that I do now, is really tapping into folks' living. I know we use the term lived experience, but I like to say living experience because they're still living, they're still experiencing those things. And so tapping into that, into getting them to understand what they're experiencing and to allow them to identify and understand the language that goes into vocalizing what those experiences are. I think that that has been helpful, especially when I was an educator, because especially for like a when I was a health teacher, back to the nutrition piece. I was in Brooklyn. There was a fried chicken spot everywhere. There was a Dunkin' Donuts everywhere. Like these were the things that the students saw, but they didn't know what a food swamp or a food desert was. So those are the things that I feel like it's helpful. It's like again back to that reframing part, giving language to the experiences that folks have, and um, I think my time in the classroom really served me well, especially when it came to facilitating adults, because I just view adults as older children, which biologically we are.
They are.
So it wasn't that scary to me to be in a room full of like, professionals and teaching them. But I also think that there was a level of, and making that connection, which isn't that wild of a connection. I was like, oh, what comes up for them? What are they seeing? And how am I tapping into that? How am I giving them space to vocalize that? What language do they not have that they need to get a better understanding of what they're experiencing? So I think that that has been really helpful, and I feel like they all inform each other. And then now with the scholarship program, I feel like that is each of those buckets. It's public health, it's education, and it's youth development, because I'm literally providing monetary support for students um, to get their degree. Without the degree, they may not be able to go to college. Without the financial assistance, they may not have been able to get into their program that they're currently at. So, and then when we just think about, the educational and levels of educational attainment and how that informs, our health outcomes, you can already see like how that intersects with one another. So, um, it's interesting in that way. Now that you asked that question, I was like, oh, my time as a teacher, and then I worked in for Big Brothers Big Sisters, which is a national mentoring agency. We had an agency here in Boston. It's interesting to see how all of that weaves into one another. So, because also in addition to being a health teacher, I also started a boys mentoring program at the school, because a lot of the boys at the school in Brooklyn were being expelled. So there was a couple steps that were being missed. Like, usually there's some sort of parent teacher conference, or a phone call goes home, and then a warning, and then you get a suspension, and then after repeated, then you'll eventually get to the expulsion. But it was sort of just like we were skipping all of those steps, and boys were just being expelled at really high rates, and so that was concerning. Um, and back, to my point that I mentioned, the student body was the inverse of the staff. The staff was predominantly white, teaching and supporting a student body that is predominantly of color. And so I felt like, through mentorship, through actually spending time with the students, it humanized them. Because there's just so much racial bias that, it is there, and racism that's at play when it comes to those sort of relationships. And I felt like mentorship was a way in which we could potentially um, curtail that from continuing to happen. The more that you actually got to see the students and spend time with them and get to understand them, like we wouldn't be so quick, and get the students to also understand that they have agency as well. Like, their educational journey is theirs. Instead of just jumping to being punitive, there was no like actual nurturing that was happening. There was no curation of like safe spaces that was happening. So that mentorship program was created to help do that. And then from there, I went to Big Brothers Big Sisters, and then went to get my master's, and then now I'm in the role that I'm in. So even now, just working that out in real time with you, I was like, there is that thread that definitely all are that are connecting all of those three pieces, which is cool to
Yeah.
think about.
Yeah, well, I appreciate you working that out with us right here live. What does public health mean to you?
What public health means to me, I would say, is the first word that comes to mind is accountability. I think we owe it to our constituents to, and the populations that we serve, to really be putting in systems in place so that everyone can reach their highest level of health. And why the reason why I use accountability, and just in thinking about now, we're in Black History Month. One of my favorite quotes is actually from Malcolm X. He was like doing an interview, and I'll read the quote to you. He said, "If you stick a knife in my back 9 inches and pull it out 6 inches, there's no progress. If you pull it all the way out, that's not progress. The progress is healing the wound that the blow made, and they haven't even begun to pull the knife out, much less try and heal the wound. They won't even admit the knife is there." So when I say accountability, that quote really comes to mind, because especially in the current age that we're in, with everything going on federally, um, we don't admit that the knife is there. We don't admit the harm and the damage that we've done to populations, especially vulnerable populations, especially to BIPOC populations. Um, we haven't admitted to that in a way in which actually speaks to our fault and our, I would say, like, as in government. And I feel like that has led to a lot of the mistrust and distrust that's currently happening currently. So for public health means to me, I think accountability. I think it's about owning that. It's about being more transparent and saying, "Hey, these are our shortcomings as a field. These are the ways in which we're trying to make up for that." And we can only really do that through equitable community engagement, through actually engaging with folks, through being transparent, through bringing folks to the table when we're thinking about policy decisions, or thinking about other community engagement initiatives. Like, how are we actually tapping into folks? So I feel like public health to me is accountability. It's about doing that work, holding ourselves accountable to doing that work, um, so that we can make better health outcomes, or see better health outcomes, I should say.
Yeah, and I think that that's a great like positioning to talk about it, the accountability part, and realizing that we haven't done the work to heal or to restore or to just have the conversation, and it's something that I think we are unfortunately kind of like moving away from, and I think
Yeah.
in that way it just creates like more space for more harm. But
Yep.
we definitely need to find a way to do that healing while we're also doing all the other equity related work that is necessary as well.
Absolutely. And I also think too, like, just hearing that, it also just makes me, and I'm curious to get your perspective, because I often feel like when we talk about healing, or when we talk about trauma, I feel like it's always rooted in the past. It's always rooted in historical trauma, and we
Mm,
miss all of what's currently happening, the
mm,
things that's currently happening for folks. Um, so like often, like when I hear of like public health, I usually hear of, like, Henrietta Lacks or the Tuskegee syphilis study, and it's like, yes, those are important, but like, what's currently happening now? You know, Black people, their pain is still not being treated as serious. There's still unfortunate um disparities in maternal health outcomes. Black women are dying at higher rates from, maternal complications. Like, those are all things that are currently happening as well, that I feel like we miss, if because we keep putting everything like in that historical bucket versus historical and current. And I think we need to be transitioning to that. Like, yes, we have to look at the past in order to position ourselves for the future, but we can't get too stuck there. So now we're not even looking at what's currently happening around us. But curious to hear your thoughts on that.
No, I appreciate that, because I think you hear a lot of sentiment around people saying, oh, that was in the past, or like, we're past that. And the reality is that many of the same inequities that existed then still exist now. Maybe some of them are even worse than they were back then. And I think it is good. And it's funny because like right behind you right now, I'm drafting out like a Black History Month post. I don't think I have any current any current people that I have there. So I'm like, to your point, I think we need to continue to highlight that this isn't something that was in the past, but it is something that is current and present, and they are leaders and people and that are doing this work, small, large, in between. So I definitely resonate with that. So you got your Bachelor's of Arts in Latin American and Latinx Studies and Global Health Studies minor at the College of the Holy Cross. What drew you to this undergrad degree?
Uh, that's a great question. So as I mentioned, I was chemistry major up until my junior year. And so at the time there wasn't a public health or even like a global health um concentration. So there was a Latin American and Latinx studies concentration. So while I was doing like the chemistry work, I was already doing the minor for the Latin American and Latinx studies concentration. Um, but then when I transitioned from chemistry, I actually decided to create my own major. My plan was to create my own major in global health studies. So at the time, Holy Cross had a 101 and like a 102 of like global health. So there was a beginner's course and then like a intermediate course for global health. We had an adjunct professor, Professor Ogimbo, one of my favorite professors. Her class like really solidified mine. So I had came back from India knowing that I wanted to now pursue public health, and then I immediately enrolled in her courses. And so that really solidified like my interest in public health as a career from taking her two courses. Um, but so through that, had to create my own major. My plan was to create my own major, was is considered a interdisciplinary degree. So that's like a whole lengthy process. You have to write out your justification as to why you want this major. What are the other courses that will count towards this major? So thankfully, like I was able to use my chemistry courses. I was able to use some of my other coursework to solidify the two global health study courses, my psychology course. So I was able to use those previous courses and some future courses to propose like this was what the major is going to be, and these are the courses, and then that gets sent to a committee that has to approve. And so they didn't approve the major; they approved it for a minor. But then they were like, "Hey, your Latinx studies minor, you've taken enough courses for that to actually be your major." So I just did the inverse. But ideally, I would have liked to have the global health be my major, the global health studies be my major, and Latin American Latinx studies be my minor. But it ended up being the inverse, just because of time constraints. I was a junior at that time, and I'm like, okay, I can't not have a major, so we need to figure this out. And then I ended up studying abroad my fall semester senior year, so I definitely had even less time to actually figure it out. So in order to graduate on time, I was like, okay, it wasn't what I wanted, but it ended up working out that way. But to answer your other question as to what drew me to them, though, I think I answered that for the global health, but I'll speak a little bit more for Latin American. Just being, growing up Puerto Rican and Honduran, I just wanted to get a better understanding of like my own culture, the history of, Latin American countries. I feel like that wasn't, really taught to me in schools. So that was always like of interest to me when I saw that we had such a robust program at Holy Cross, that I knew that I wanted to learn more about my heritage. And learn more about the history, learn more about like the politics behind like even like the creation of like the nations. Like we got into that a lot, which is also cool. Even thinking about like Afro Latinidad, which also became a popular topic while I was in undergrad, around just like what are the roots of the African diaspora in Latin America. Latin America has the most African descendants in the world, so but like that's not always taught or like known. And so that was like one of the things that I also was interested in. I ended up doing my capstone for, was looking at the Afro-Cuban experience, and speaking more of like what Black identity looked like for Latin Americans in actual Latin America, because there's also that distinction too. There's what that experience looks like in their home countries, but then also like what does it look like when you're in the U.S. and you identify as both, Black and Latinx.
Yeah, I appreciate that. And I don't think I realized the extent of the Afro Trinidad until I went to Nicaragua, and I met people
Mm,
from like was it Corn Island,
mm,
and they were like talking like they were from Jamaica, but it was so
yeah,
fascinating to me. Looking like yeah, it was fascinating to me.
yeah.
But yeah,
Especially for Central America and like South America, like Jamaicans were like the second wave of
right,
laborers after enslaved Africans. So like even when I went to Panama, I went to the canal and I was like, yeah, this was built by Jamaicans.
yeah, yeah, that's real. Quick question. You said that you wanted the global health studies major, not a minor. Did it matter in the end currently?
Hmm. Oh, did it matter in the end?
Yeah.
No, I
No.
don't think so. And now I'm like blessed to know that my format is now being used by the institution. So students are actually able to look at what I put together and put that as like the official global health studies minor. And they've probably added like some additional courses since then because I graduated in 2017.
Hmm.
Which is crazy. Next year will be 10 years. But yeah, so it's been great to know that that has been established a lot more. And there's actually like a real solidified concentration so that students don't have to put in that same groundwork to create, unless they create something else. But yeah, it was a lot of work. It was very nerve wracking to literally go without a semester of like knowing because it really you're at the mercy of the committee to say when or if, and then it's like if they don't, then you have to scramble to figure something else out. So um, to know that students don't have to like jump through that hurdle the same way has been like really reassuring and nice.
Yeah, shout out to you. That's some advocacy work right there. um, and I was gonna ask, so you said you came back from India, you had a conversation with the professor, and they're like, "Oh, that's not medicine, that's public health." At that
Hmm.
point in time, what did you think you were gonna be doing in public health?
That's a good question. What did I think I would be doing in public health? So actually, I thought that I was going to be more so in like doing global health work
Hmm.
than public health work. Just due to my concentration, due to those two courses that I took with Professor Ogembo for global health 101 and 102, or was it 101 or in 201? I can't remember, but intro and then intermediate. From there, when I studied abroad, I actually studied abroad in Costa Rica. So I did. It was a part of the Organization for Tropical Studies in partnership with Duke University. So it was a global population health and neglected tropical disease core program. So I studied neglected tropical diseases. And was able to give like policy implications for the Ministry of Health there on what they should be, what they should be doing. So my particular capstone though was around snake bite envenomations. At the time, the World Health Organization took snake bites off of the list of neglected tropical diseases, which we called NTDs. And even though like the global burden of snake bites was high, um, it was really detrimental that they took it off that list because usually the implications of an NTD not being on the list is that really directs like funding and resources towards research. So if it's not on the list, then that's less research that's gonna happen around it. That's less funding that's gonna go towards it. And again, what we knew of like the global burden, the scale of snake bite envenomations, like that needed to be back on the list. That still needed the global attention that it unfortunately wasn't getting because it was taken off. Um, and then one of the things, so my particular capstone was around perception. So what is the community's perception of snake bite envenomations? Their perceptions in regards to like what are they supposed to be doing when they have a snake bite and what resources are available to them. And then also providing policy implications to the Ministry of Health to also use the language of the community when they are giving out pamphlets or giving out resources. Because there was another it was snake bites, and then I also was looking at leishmaniasis. And so in Spanish, I believe it's just leishmaniasis, but with like an accent. But the community calls it papillomoyo.
Mhm.
So it's like if you're the Ministry of Health and you're saying, "Oh, hey, like leishmaniasis," they're not using that term.
Yeah.
So it's like we need to be using the language of the community to better their perception and understanding and awareness of these tropical diseases so that they can get a better understanding of the precautions and safety measures that they need to be taken in order to remain healthy. Um, so after that experience coming back, I just thought I was like, oh, I'm gonna work for like the World Health Organization. I'm gonna do X, Y, and Z. So I think like my main focus was global health at the time. But then it transitioned more into like thinking like locally. Because after undergrad, that's when I went to Brooklyn and I became a health teacher. And I got to just see like that what that experience was like being at that level of things and like helping support the students and their families on how to be healthier. So that sort of like transitioned my trajectory from thinking about global to more of like the local setting, and then from there just kept going and now I'm here.
Okay. Well, I
Yeah,
appreciate you walking us
same.
through that as well. And yeah, so you graduated from undergrad, went in to become a health teacher, also did peer mentorship work, became the assistant director of admissions for a high school as well as
Hmm.
a the
I was doing both at the same time, teaching and doing, yeah.
that's a lot.
Give school settings, staff in school settings, we need more money. It's not a joke when they're saying that they're underpaid. We're underpaid.
That is
They're
very true.
underpaid.
Very true. Very necessary and unfortunately very underpaid.
Hmm.
And then you're also big brother, big sister. You also
Yep.
worked as a services coordinator. Um, was there anything that you wanted to share about these roles? I know you kind of touched on them earlier.
Um, no, I think just thinking about that connection, which I feel like I spoke to extensively. I think we, I think actually what I will say is that they helped broaden my understanding of like the social determinants of health. Um, and I know like some folks will call them like public health adjacent fields, but I don't view them that way. Like they definitely, especially when you think about like ACEs, adverse childhood,
Yeah.
um, what's the E again?
Experiences.
Adverse childhood experiences. Thank you. And just like the implications of that on like health outcomes, behavioral decision making as well. Like it's just when you think about those things, when you think about your level of educational attainment, and how that influences your health outcomes, like you start to think about it differently. You don't view them as adjacent or as additional. Like you view them as what they are. They are determinants of health.
Yeah. Absolutely. And you kind of shared about the mentorship program that you started while you were there as well, which I also think is like so important because we often treat the issues of things, whether that's disruptions in class or things like that, without trying to think of how can we invest in the prevention. And I think that is one way that you tangibly did that. And I can imagine like that in itself is a public health program to some degree.
Yeah.
And then like after that, you went on to get your master's of public health in health services management and policy at Tufts University School of Medicine. What was the motivation? What pushed you to go for the MPH?
Yeah, I would say the motivation was COVID. At that time, COVID was happening, and then we just saw like what folks were calling at the time a double pandemic. So folks dying from from the virus, but then also dying from racism. The impact of racism on vaccine equity, access, on just how the virus was spreading to certain communities, or how certain communities were dying higher. So like black and brown folks were dying at disproportionate rates than white folks, and that came down to access. So that actually led me to volunteering with our the the Black Boston COVID-19 Coalition, which was really just aimed to increase vaccine awareness, but then also um, distribution, like how many folks can we actually get vaccinated, and also charging the state and the city of like, hey, we need to do something. So we had mass vaccination sites, but the first one was opened in Gillette Stadium, and then the second one was opened in the Fenway area, which again, as I mentioned, black and brown people are dying disproportionately. Why are we opening up vaccination sites in areas where they don't reside, in areas that they can't get to? Especially if you're thinking about like transit critical folk, how are they supposed to get to Foxborough and they live in Roxbury and they don't have a car, or they're struggling, to pay their rent, or they're struggling to have food, to pay for food, nutritional food. Um, so it's like all of those things where it's just like, okay, like I get it, we needed those sites, but if they would have had an equity lens, if they would have had that mindset, being like, all right, let's actually put it where those folks are, Not saying that, again, those sites couldn't have happened or shouldn't have happened. It's just the order in which they happened was a head scratcher for sure. um, and so, yeah, I would say, thinking about that experience, now I feel like I lost your question.
No, like, but how did that connect it to you wanting to pursue the MPH?
Okay, yeah. So that at the time, so after doing that work with the Black Boston COVID-19 Coalition and getting folks, I knew that it was just time for me to go back. Again, I felt like I had this mindset of that I was doing public health adjacent work and not really like doing public health work. I was at the time also contemplating potentially getting my MSW from just being with like the youth for so long and being in like the educational space. I thought that maybe potentially instead of an MPH, I would pursue my MSW, and I actually got into Fordham's MSW program and was gonna do that, but then I ended up deferring and moving back to Boston from Brooklyn. So then that extra time, like with working for Big Brothers Big Sisters, I think was helpful. And like, okay, like now that we're actually in this pandemic and this is happening, like we need more folks to actually do something about it. And I think because of my experience being, oh, this is so public health of me, but you know, the social ecological model. I was gonna say me being at the individual level really influenced and informed my decision, not only to get my MPH, but also to do health management and policy. Because I feel like, not that I feel like I know, and we've known, and history shows that when you don't engage the community and you make policy decisions for said community, you don't get the outcome that you are. We don't get the outcome that actually serves the community.
Right.
And I feel like because I was at the individual level, I was able to bring that with me of like, hey, I'm actually informed because I've spent time here. These are the things that I can bring with me into those spaces of, hey, that's not actually the best outcome. Did you actually ask anyone? Did you actually engage the community? Did you do RFI? Like, where's the community engagement? And I feel like folks who don't have that background of being at that individual level, or even at the communal level or interpersonal level, like they're not really seeing that at the like that's not at the forefront of their decision making. That's not at the forefront of their thought process when they are making decisions. Um, and so I would say that that really was like, okay, now's the time to go. Um, you know, people are dying. We need to really be addressing this. And again, those policy decisions, like the first mass vaccination site was nowhere to be found for the people who really, everyone needed it, but for the people who were dying disproportionately, you would have assumed that that would have been placed there and not where they can't even access and reach it. So, I think that those experiences definitely is why I wanted to pursue my MPH, and then particularly why I wanted to pursue that particular concentration.
Were there any foundational experiences that you had throughout your MPH you wanted to share?
Oh, good question. Mm, Mari, you have so many good questions. Foundational. Actually, yes. I also took another global health course, and so that was like really cool to take. It really put into perspective like how we've addressed epidemics or pandemics in the past, and then as I mentioned, when I was in school, it was still like that first year. So I started fall 2020 in school. So we were virtual that first year, and then my second year we went back into person, but then we had to like swab and get tested regularly, wear masks while we were there, still social distance while we were in the classroom. But my global health course in the spring was really speaking to you know, how we've managed this in the past, and it was like really cool to see like just the difference in how we were handling it now. And for some folks, you know, they would argue that we really mishandled the COVID-19 pandemic, which I think it was like an interesting topic to really be diving into. So I felt that that like helped me understand like, oh, like these are the things that we could have been doing that we've had experience doing. So why are we choosing not to do it this way? And then I would say my second foundational moment was I took a substance use disorder class, and that was really informative for me and really transformed the way in which I think about substance use and those who struggle with substance use disorder. It was called Snort, Swallow, and Smoke. It was like one of my favorite classes ever in my MPH program. Um, and it really it really made me think about like how I view substance use disorder, how I view folks who are dealing with that, and how I view harm reduction. We got to visit a couple of shelters, and also we got to visit BPHC. Actually, we got to visit BPHC. We under our Recovery Services Bureau, we have it's called A Hope, and it's like a needle exchange site, but they also do like a lot of education and training around substance use. They provide trainings as well. Um, and actually, our guest lecturer is now my coworker because now I work for the Boston Public Health Commission, so it was cool to like see him. But I would say that course really transformed my view and understanding. I now currently think of money as a method of harm reduction. I know that has been like something that we grew up with. Was like, oh, when you see someone asking for money, who's someone who needs help, sometimes the immediate reaction is, oh, like don't give it to them because they're just going to use it for drugs, or they're just going to use it for X, Y, and Z, for something that is unfavorable in our perception. But um, if me providing the money gives them an opportunity to not engage in an additional risky behavior in order to get that drug or to get whatever they're searching for, why wouldn't I give it to them if I have it? Um, and so that came up in that course in particular. And so I struggle with it because I don't carry cash, but I try to like leave a little bit because I feel like money is a form of harm reduction. And it was through that class that I really got to learn that. I got to hear from folks who, were survivors who, would share like all of the different activities that they would engage in just to get that fix, or just to have money to do X, Y, and Z. So when you're thinking about, comorbidities of folks who use substance use, and then, other health implications that they might have, if my little $5 can help them, dissuade them from doing that so that they don't develop, any further health issues, then why not? So I would say that was like probably like one of the most transformational classes that I took. And then on a personal level too, like, my father and my aunt, and my grandfather actually all suffered from alcoholism. So it also, I think, transformed and deepened my understanding of them and like what they went through, in my relationship with them, and the feelings that I had for them. Um, from like a more of like an angry place, or more of like a understanding, a deepened understanding of, their struggle. And it really is an illness. And that was one of the things that we also spoke about too, was, we think of it as like a risky behavior, but we don't condemn folks who are, you know, driving crazy on motorcycles as much as we do, for folks who are using. So, and their mortality, we see the numbers all the time. So it's like just thinking about that as well. I feel like, yeah, that class. Shout out to Professor Skier at Tufts University. She really changed my thinking for sure.
I love that. I haven't heard that like said so eloquently. I feel like I've had conversations with many people over the years about like the like money, as you said, like money being harm reduction, but like the fact that you giving someone money, it doesn't matter really what they do with that. Like you should know that your part is like supporting that person and doing what they need to do at that point in time. And I think your perspective just now kind of like even created it a more concrete example of like, hey, if you do this, it reduces a potential other risky behavior or risky encounter that they might have to do. So definitely appreciate that concrete example. And I probably will ask you for Professor Steer's name.
Scare.
Scare.
I'll send it to
Yeah.
you.
Awesome. That's dope. And then so after you graduated, you had a role as international division.
Yeah, I served as a intern in the international division for John Snow Incorporated, which is like a major global health firm, consulting firm. And I was able to just get a better understanding of like what consulting would look like, because at the time I also was thinking about that being a potential career for me. So at the time I got to support two USAID funded projects. One was called Zambia Safe, so that was around like supporting providing supports for like the HIV/AIDS epidemic in Zambia. And then the other was it was in so that one was more established, and then the other project that I got to support was in startup, and that was around maternal and infant health in Lao. So that was pretty cool to like have both of those experiences of like what is it like to jump on a project that's already um seasoned in senior, and then what it was like to actually be on the other end of like, okay, this project is now in startup, so who are the stakeholders that we need to engage? How are we getting folks actually in that country to, come to the table? What does M&E look like? Monitoring and evaluation look like? Setting up like those sustainability measures. So thinking about all of those different things. Unfortunately, I was only there for a semester, but it was a really cool experience just to get a sense of like what global health consulting looks like, and again having that experience of seeing project management from both sides of a more consistent and senior project, and then one that's in startup. But it was really cool.
Yeah, that sounds like a very formative experience as well. And you graduated and you worked for Tufts University School of Medicine as an admissions ambassador as well as a DEI consultant. So tell us a little bit about those.
Yeah, so also for the admissions, that was also like during my time there.
Mm.
So really just thinking about how are we recruiting, more diverse pool of candidates for the MPH program. Um, I was probably the only black man in my class for a good portion of my courses. There was maybe like one class where there was another man of color. But definitely I believe in all of the courses that I remember taking, I was the only man of color in those courses. So that was one of the reasons why I wanted to think about joining like the admissions team and like really having more of a voice to that. Like, hey, like we need a more diverse pool of candidates, more diverse student body. So that was really cool. Some of the students that I actually got to support actually joined. So my second year, they ended up attending and being first year students in the program. So I got to see some of them and like mentor them a little bit. It was still, again, a very weird time because of the pandemic. So it was like social interactions, like we were in class and we were in the building, but it was like you're not really hugging or doing any of that or really
Yeah.
socializing. So that was the only detriment. I really wish that maybe I would have went at a different time, but
Mm.
I was very adamant about not taking the GRE. So when those got waived, I was like, okay, this is another opportune time to apply. Um, but yeah, and then for the DEI consultant role that came after I graduated, I was supporting the Office of um, Diversity and Inclusion. So there was two associate directors of diversity and inclusion that I was supporting, and really just thinking about like tough about the schools, like overall like strategy, thinking about supporting professors. There was like a strategy arm, but then it was also like a training arm, so also think in facilitating arm, so thinking about racial bias, implicit bias, racism, structural racism, but doing those sorts of trainings, not just for the student body but then also for like faculty and staff. So there was like supporting programming for the students, but then also supporting those trainings to bring staff up to speed, so that they knew and understand their role in pushing for racial equity and justice. And then also like organizationally, one of the main projects that I also got to support was really thinking about their Juneteenth celebration. It was when I believe Juneteenth had just became like federally recognized, so they Tufts was putting together a celebration. So also thinking about that was really cool. Being able to support them in planning that, what that looked and felt like, what the communications looked like, what was the programming like, how does this relate to health. Um, yeah, it was a cool experience. And then from there, I entered my current role at the Boston Public Health Commission.
Awesome.
Yeah,
Awesome.
a lot of facilitations and trainings as well in that role. And then I felt like that also served me well when I applied for this one, because I had the facilitation and training for faculty and staff through Tufts, and then I had my time in the classroom with um, students, my younger adults.
Yeah, highly underrated, I think, skill sets in public health, like being able to facilitate and coordinate meetings and things like that, and trainings and all of those types of things.
Yeah.
Um, you kind of spoke to it as well. So, like, being an admissions ambassador, you realize like there aren't enough men of color in public health. You are also the chapter lead for the Greater Boston chapter of Brothers in Public Health. So tell us a little bit about that.
Yeah. Should I mention that you're on it or
Yeah,
not?
you can mention. Yeah, it's fine.
I wasn't sure if that was like a conflict of interest.
No.
But but yeah, so thank you for that. As you mentioned, I currently serve as the chapter lead for the Greater Boston chapter. I believe I've been in the role now for a year or so. A little bit over a year because we just released our year in review. So that's been like an amazing experience being able to, work with you, work with Winston, Savion, Darwin, and for folks who are listening, these are also other members of Brothers in Public Health that I've been blessed to be able to work with. And yeah, it's been great just in thinking of like your comment around like what I realized and noticed in my MPH program, like there aren't enough men of color in public health degrees or in public health or pursuing public health degrees and pursuing public health careers, which, is not okay. I think we really need to get we need more representation for sure because we need folks, men of color in particular, to understand like the role that they have when it comes to bettering their health and understanding the systems and institutions that inform and impact their health. And when we think about representation, we need more men of color in order to be able to speak to that. There's a level of representation that leads to familiarity and comfortability for men of color who might be struggling to go to the doctor or to think about you know pursuing healthier behavioral choices um or just engaging in our systems that are unfortunately rooted in white supremacy, which don't serve them in the way that they should be. So through being able to actually educate and teach men of color about these topics and then hopefully support them in wanting to pursue a career and degree in this will hopefully help us in being able to envision a world where there are less, public health issues that are impacting men, and especially men of color, disproportionately, so that their health outcomes, that their lived experience, their life expectancy gets better and increases.
Yeah.
So it's been great being able to support that mission, and locally in Boston, we are the first chapter, which um, has been great. I feel like I'm always in a position of first. This is my first role at the commission that no one else has been in, and now I've been able to support the establishment of the first ever local chapter for this organization. So it's been great, just like building it out and seeing what we're able to accomplish and do. We've been able to maintain a cadence of 2 events per quarter, in-person events at that, just spanning different, initiatives. We had our Cuts and Conversations event, which provided mental health and other mental health resources for folks, for men of color in particular, and then also provided complimentary haircuts. Because when you look better, you feel better, all of those things. And we had a mental health clinician come and speak to provide a safe space for those men to be able to share, the challenges and what they're going through as it pertains to their mental health. Um, we partner with A-Hope, as I mentioned earlier, our harm reduction center for the city of Boston. Um, what else did we do? We did a lot. We were able to support the health equity bill, the health equity bill through the health equity compact. So we actually got to go to the state senate and be in support of that. The state house, excuse me, to be in support of that. So yeah, we've been doing a lot of like great community work. I'm definitely looking forward to growing the chapter. So anyone who's listening, if you want to join, we need more hands. We would love to have you. Yeah, I'll stop there. Any questions?
Yeah, plus one to all those things. I think one of the things that is interesting, is stark in public health, is just like we talk about all of the issues, and many times the people that are most impacted are men of color, and then yet when we look at the field, the representation is not there. So if you know person of color, man of color that's interested in public health or has some sort of interest in the health field, point them our way. We'd love to connect. And yeah, because I think there's meaningful work to be done there. So I appreciate you launching that first chapter and all the amazing work that you'll have done up to now.
Awesome. And I appreciate all the support that you've given us.
Definitely my pleasure. My pleasure. So shifting us a bit to before the Furious Five, I have the past week's guest question. I don't know if I'm phrasing that right or wrong, but I'll think about it later. But the question from the guest, from a guest from our past week, and the question is: What does creative health mean to you, and how do you practice it?
What does creative health mean to me and how do I practice it? I don't know why, but when I think of creative health, what immediately comes to mind is, really thinking about um, zooming out. I think another thing that comes up with doing this work, I think sometimes we can get too into the weeds, and so we actually don't allow ourselves to be creative. So I think when I think of what does creative health mean to me, it's allowing ourselves to think. Um, and it's funny because I found myself like being in the habit of saying to folks like, "Hey," especially at work, I'm like, "You pay me to think, so can I actually have a second?" And I think for anyone who's listening, especially for future professionals, even current professionals, like you are entitled to that. You're allowed to say, "I need to pause, I need to ponder, I need to think." You don't need to rush always to have an immediate answer. And so when I think of creative health, I think about really like taking that time to zoom out. Um, so that you can really think critically and think I guess in a fun way. I don't know. For me, thinking critically is fun. I know that might be that might be a contentious topic, but and I don't think that you can really think critically if you're not thinking creatively.
Mhm.
Um I don't know. For me, they go hand in hand. And so for me, I would say like I practice it by making those intentional spaces to zoom out, to take time. To really think about like the intersections of things. I know intersectionality is like always like a buzzword for public health work or health equity work in general, but like really thinking about how things connect, I think allows you to also think about where things don't connect, where those disconnects are. And I think that that's great in identifying like creative solutions. So yeah, that's I think how I would answer that. Because even in thinking about like I mentioned earlier the Generational Health Scholarship Program, we and before I say that, back to the creative health piece, I feel like it comes with engagement. Like you need to be engaging with others as well. About your thoughts. So zooming out, but then also engaging. So now circling back to the Generation Health Scholarship Program, we received that funding from the city. The city declared racism public health crisis, and instead of us just saying, "Hey, we're just going to do what we want to do," we went to the community and said, "What do you all want to see us do with this funding? What are some public health priorities that you all want us to address?" And education was one of them. And then we had the creative ability and we had the parameters in place to understand like, okay, how far can we go with this? And so we created the generational scholarship program, which is in alignment with what the community asked us to do. You wanted us to address educational attainment because we know, again, the relationship between educational attainment and health outcomes. So now we have a scholarship program that I don't think would have been able to happen if one, we didn't engage the community, and two, we didn't take that step back to zoom out and say, what can we be doing? What's an area that we haven't addressed? How are we thinking about the determinants of health? Instead of just saying like, oh, like let's just give the money to X, Y, and Z. We wouldn't have done that. We wouldn't be where we are now with supporting these students getting their degrees if, we just thought like, oh well, we'll just make the decision ourselves. So yeah. So I would say creative, definitely that's where my mind goes. I don't know if that's a creative answer, but
No, the answer is the answer, and I think it fits well. And I, I I agree with all you said, and I think it's awesome that you also did some like authentic community engagement in before spending the money and supporting like what is done, because I think too often it is an afterthought or a oh we have to do that again, but it is truly like a big part of how we need to continue to do this work.
yeah, absolutely.
So shifting into the Furious Five, the five questions I ask all guests. Number
Okay.
one, number one, what advice would you give to a student trying to pursue a career in public health?
Oh, good one. I would say if I said I would give a student that wants to pursue a career in public health, I would say be comfortable with how, again, I mentioned it can feel really amorphous. There's so many different parts of public health that you could be doing. You could be doing epidemiology, you could be doing policy work, you could be doing like harm reduction work, etc. Like there's so many different roles within public health. So I would say one of the things that I would say is don't get overwhelmed, and definitely spend more time being discerning, like what about public health interests you, and being comfortable with knowing that there might be different outcomes for that. There might be, for the same passion that you have, there could be different branches that are branching off of that. But don't get overwhelmed, and just know that whatever decision that you make is your decision. There isn't a right or wrong decision. Each decision that you make is a step in the direction that is ultimately going to be your journey in your life. So the only wrong decision is not making one.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Definitely have an open mind. You definitely need to be people centered. I think one of the things that we miss from doing this work, especially like now that and I love being hybrid, but I have come to like really understand more like the importance of human connection,
Mhm.
especially in doing this type of work, doing health equity work. You really need to be thinking about that human piece. Like, what is that term called?
Not sure.
It's human centered approach, but
Yeah. Mhm.
is it human in all policies?
That sounds right, though.
But the purpose of the term is to understand that in whatever organization or whatever level, especially if you're thinking about the social ecological model, there's always people there. So those are the folks that you need to identify, that you'll tap into for, like, they can champion your work, they can support your work. So getting a better understanding of like who to go to for who. But there really is like a real people centered approach that gets missed in this work. Um, that it can't be replaced, especially in thinking about, being pleasantly persistent. As I mentioned earlier, like sometimes people don't get back to you, but instead of me sending them 4 emails about it, how about I just go actually walk over and check in on Johnny and see how Johnny's doing? Why isn't he responding to me? What's happening for him? What's coming up for him that might be impeding him on getting back to me on this initiative? And so I feel like we miss that. We just get so into the weeds and just think like, okay, like what can you do for me, instead of how I can be supporting you, how can be working together. So I would say for this role in particular that I have, it takes a lot of connecting. It takes a lot of um, collaboration. It takes, again, that understanding that these are people that you're working with at the end of the day. So it's, yes, we know that work matters and we have to get work done, but you it will serve you if you really think about that people-centered approach, for sure.
Number three, what's something you're working on improving in your life right now?
I was gonna say education. Yes, I am thinking about that. I'm not quite sure yet in regards to what I want to do. I'm currently thinking about DRPH. Um, Funny enough, med school has been in the back of my
Hmm.
head now, which, you know, need to discern a little bit more. I'm like, okay, does that feel like unfinished business because that's what I've been told that was I was
Mhm.
supposed to be doing, or is that really something that I'm now feeling like I can actually devote time to do, or that I really want to do? So, and then someone asked me like, why can't you do both? But I'm like, that's a lot of money and time, but we'll see. But definitely thinking about next steps in regards to my education. But then also, I would say what I'm really working on in the immediate moment is just my physical health. I've been doing CrossFit a lot more, and just exercising a lot more, just getting a better understanding of how I've always been sporty-ish. Like I played soccer, I've tried out football. Those are the main two sports that I've done. Got some swim lessons like during summer camp and stuff like that, but and actually like, taught a couple people how to swim. Um, but other than that, I would say I'm really trying to think more about like my physical health. So, especially from like a nutrition piece as well. Like I have not been the best, but I'm getting there
It's a
when it comes
process.
to food. Yeah, exactly. And just really understanding our relationship with food, especially like as a person of color, especially as, someone who's Caribbean and African American. Like there's just so much history and culture that comes with our food, and like the choices that we make when it comes our relationships with food. So just getting a better understanding and learning of that, and again, not I keep reminding myself I don't have to give up the flavor in order for it to be healthy. I feel like that's what I've been struggling with. But yeah, nutrition and exercise for sure. I feel like my physical health has been on the top of my mind a lot, and just in thinking about just again, my work. I'm currently in the process of supporting our um Black Men's Health Conference. Data, came out, and it's unfortunate because it's not necessarily new data in the sense of like the trend. It's new data because it's new data that's been collected, but the trends unfortunately aren't different, and Black men unfortunately are dying, at disproportionate rates in Boston. They have the lowest life expectancy out of any population here in the city. So knowing that, I feel like has really been serving as like an impetus for me to want to do better and be better,
We're wishing you all the
and I
best on
will.
that. You will indeed. Number 4, professionally, do you recommend anything?
So I would say Unnatural Causes is a documentary that I would recommend anyone who's interested in just getting a better understanding of public health. There's a particular episode of that documentary series called In Sickness and in Wealth, and it really it follows different employees at the same hospital at different levels and their different educational attainments, and it shows how that impacts and informs their health outcomes over time. And then it just speaks to, racism, it speaks to weathering, it speaks to all of, different health issues that really impact like people of color in particular. Um, and so I think if for anyone who really wants to get into it, I think that that's a great documentary to watch because it sets the tone for sure on why the work that we do is important, why public health matters, why public health is a professional degree and career.
And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
One piece of advice I would give to my younger self, and I think that I need to remind myself now, is that it's okay to ask for help. I think I'm the eldest child, I'm the eldest grandchild, and so I feel like I'm always constantly being put into the leadership position by default, and I think that also translates into work for sure for me. So I feel like I take on a lot because I can produce, but just because I can produce and actually do it well doesn't mean that I should or have to. So I think that's been something that's been on my mind, and that I would definitely tell my younger self and my current self now is ask for help. It's okay to ask for help. You don't need to shoulder everything.
Love that. Well, Alex, it has been a pleasure chatting with you, learning more about your journey. I learned more about you today, and look forward to continuing to learn alongside you. But this has been awesome. Thank you so much for sharing.
Likewise, thank you so much for having me.
It is my pleasure. Housekeeping items, everyone. Thanks, everyone, for watching or listening. Be sure to hit that subscribe button if you have not as yet. Leave a like, leave a 5-star review, and share this with a friend. Greatly appreciate you all. See you all next week. Peace.